Hey, good morning, everybody from the West Coast. I know it's afternoon, well afternoon there, and I'm later than usual, but still, happy Friday. It is Friday, and thank you for joining me. I know that we were this week talking about Minority Mental Health Month, and I want to take a pause from that. I'll continue Sunday on Say It Sunday and also Monday, Tuesday, and Wednesday so we can continue that. But there's a big problem that I wanted to talk to you about adult children. That's right, and that's me too. I was telling me and my brother, we are the adult children, and we are always conferring to make sure we know what's going on with our mom. Now, listen, I am here away from home because I am working for two other clients, and well, they both have adult children, but one adult child uh, does not have the ability to help as well. And the other ones, of course, as most of you are working full time and do not know the health care in a manner that can get them the results they need. So that's why I am helping them. So I'm specifically talking about what's going on. They're your parents, but it's their health care. If they have Medi-Cal, I tell you, Medi-Cal is really Medicaid, except in California. They have their own name, but it is still Medicaid. And then there's Medicare. Medi-Cal, Medicaid, and Medicare are all service run by, come under the CMS, that's the Centers for Medicare Services. The federal government funds all of those programs. So I have an instance I want to let you know that when it comes to either Medi-Cal or Medicaid, I'm going to say it about these two because I know for sure, and I'm sure there's some places with Medicare depending on your location if you're living in a rural community. And have a PCP, but that PCP is not of their own practice. The PCP is part of a clinic, which means it is part of a rotation basis that the doctor may be there 2 or 3 days a week and another doctor may be there, or sometimes there's not even a doctor that's on site, but they have a lot of options, subgroups. And so what am I talking about? I'm talking about the fact that when you need to get an authorization, there's an option you push for it. If you're looking to see what happened to a referral, there's another option you push for it. And they might have 5 or 6 options, and guess what? None of them will lead you to the doctor's direct line office. You have to leave messages, and if you want an appointment with that doctor, and I can imagine it's pretty frustrating. And not only that, this could be why when you ask your parents about did they get a return visit, they go to the doctor, they just said they feel better and they don't follow through with going. Because although you may have their medical card, have a copy of it, and it says Dr. So-and-so or whatever it may say, the point is it is pretty hard to get extra prescription if the pharmacy has to call and verify something. Even though there's a pharmacy line, if the pharmacist does not have the order, they too have to wait and call the doctor, or the doctor's office needs to call them. And so I just want you to be aware that perhaps the cooperation you think your parents are not giving you is because they're not telling you how frustrating it really is to get these things done. Even myself, when I've reached out to the health insurance carrier directly, because now at least some of the Medi-Cal and Medicaid, they are contracting with the larger insurance companies to be like the IPA, the independent providing agent. And so therefore it might say they have, this is who you go and get customer service from. Now, what I have found is this is where you call customer service, the insurance company, but the provider themselves, who is the doctor, does not necessarily respond to even the insurance company. So who's running the show? I say if the people that are paying the providers can't get them to call, what do you think about the parents? What do you think about people that are not feeling well and are always in a fight to get a new prescription, to find out all the questions? We tell our parents to ask the doctors, and we think like they just don't ask. It is that they don't have the capacity to go through the enormous drudgery of being on hold, going to another option. If you push the wrong option, waiting, coming back in the rotation, it's pretty awful. So I'm asking all of us to really get involved in these particulars. Find out and just do a test. Just call the number that's on the doctor's on the card. Call and see how easy it is for you to get and leave a message for the doctor, or to talk to the doctor directly. Try asking some of the questions that you're sending your parents to ask and see what they are really going through. I think that the only way for us to ensure that they are getting the best quality of care is to really get in the trenches with them and to make sure that they are getting what we know they should get. Regardless of the healthcare coverage, regardless to who the IPA is, where they live, they're entitled, as we all are. I tell you always, what? Excellent health care is not a privilege, it's your right. And now I've added the point that I want you to understand it is also your definite responsibility. All right, thanks for joining me. I have to go off to some appointments, but I thank you for joining me on this Friday. I will see you at 5:30 p.m. on Sunday for Say It Sunday. All right, have a blessed one. Thank you. Bye.